Well, I think that the conversation that Mr. Boehner needs to have is not with me or the folks at HHS. It's with his constituents and people across the country, because by January, there will be millions of Americans who will be receiving direct benefits from the passage of the law. Again, parents with kids who have had pre-existing conditions, parents who have young adults on their plan, the folks who have now the comfort of insurance without a lifetime cap. Annual caps will begin to change. Preventive care that will be offered with no copay. Medicare beneficiaries who next year will begin to see a 50% decrease in their donut hole payments for brand name drugs, and that will decrease over time. Medicare patients who will finally be entitled to an annual wellness visit. Our efforts on fraud, I mean, one of the lesser known topics in this bill is it's the toughest anti-fraud measures and tools that we've ever had in this country to give us the opportunity to build whole new data systems that we can share real time with law enforcement and go after the folks who are scamming the system out of billions of dollars with strike forces on the ground. I mean, all that will be jeopardized by the lack of ongoing implementation funding. And you know, the notion that we will repeal, I think the question is, and go back to what? Leaving 50+ million Americans with no health coverage, with rates continuing to dramatically increase year in and year out, with no safety net system, with no focus on the future, and with, frankly, an increase in the deficit that, according to the Congressional Budget Office, the implementation of this bill will reduce the deficit by $100 billion in the first 10 years and by close to $1 trillion in the second 10 years. I mean, that's really what I think has to be debated.
If there is a Republican majority that is making a serious effort to roll back the law next year, are you confident that the allies you had in the fight will stick with you and support the legislation as it stands now?
Again, I think that the debate that I hope will engage in the next 6 weeks in districts across the country, but then certainly in the new Congress, whatever the makeup is what is the alternative? I participated actively in the conversations for a year and a half in Congress, and what was striking to me is that there was never really an alternative put forward. We don't like this proposal. We don't want to go down this path, but no strategy for what to do about the now 50 million Americans that are uninsured. No real strategies about cost control and containment. No strategies about how to go after fraud. All the ideas that were put on the table were essentially incorporated. So I think there's got to be a realism about this debate. We have a very broken health system. I think we have a framework with enthusiastic support of a lot of medical providers, a lot of hospital associations, certainly a lot of consumer groups and others, and business owners who are seeing their costs continue to skyrocket. I mean, the Business Roundtable was very much a part of this discussion all the way through. So I think that there are...
Are you confident all of them will stick with you?
Well, I hope so. I hope that, you know, the politics of the future will be about a realistic look that we have to have a health system that works better for everybody. And right now, the framework that has passed gives us that opportunity. Will the bill need fixing along the way? You bet. You know, Medicare today looks little like it did when my dad in 1965 was a member of Congress and voted for Medicare, sat on the Energy and Commerce Committee, and helped to pass that bill into law. He's now 89 and likes the benefits, thank you very much, that provides, but it doesn't look exactly like it did in 1965. It's changed and developed along the way, and I think that's the framework possibility that we have. This is built around the private market, and we need the private market to, you know, survive, to stabilize, and right now we're seeing a very fragile private market. So a lot of the not only did the consumer protections end some of the worst abuses, but a lot of the features of the early bill really helped to stabilize, bring people back into the private market. The early retiree benefit package, which we've had now over 2,000 companies sign up for, is to keep those programs in place so employers who offered ongoing health coverage to early retirees can help pay the higher costs. The small employer tax credit is to bring people back into that market, to stabilize the market so that when we get to 2014, we don't continue to see a downturn in the number of people with private insurance.